Can't get around it. Thanks, Sam. Osteoporosis is a serious endocrine disorder that affects millions of Americans every day. For many, it's difficult to tell when their bones are weakening, so it's important to understand how serious the disease can be. Here to talk about osteoporosis and how to treat it is Dr. Michael LeMay, an endocrinologist with Hartford HealthCare Medical Group. Doctor, welcome.
Thanks for having me.
Thanks for being here. So what is endocrine disorder osteoporosis, and who's at most risk?
Well, it's a very common metabolic bone disease in which bone density decreases over time, which leads to an increased risk of fractures, especially lumbar or lower spine fractures and hip fractures, which can be very disabling over time. There's approximately 3 million new cases of osteoporosis per year. Those people who are at risk, obviously older people, women more than men, postmenopausal women. If you have a history of celiac disease or tobacco smoking, sedentary lifestyle, those are risk factors. And men who have been treated for low testosterone also at risk for osteoporosis.
Interesting. All right, what are some of the signs and symptoms of osteoporosis that one should see a specialist?
Well, it's an excellent question. This is a disease which often is symptom-free. In other words, you don't know you have it until there's a fracture. But if you happen to notice loss of height, stooped posture, or if you have a previous history of fractures, you should definitely be screened for osteoporosis. And whether or not you have symptoms, if you're a woman over the age of 60, you should be screened for it via a bone mineral density test or a DEXA scan. Your primary care physician can usually order that test, and it will help to evaluate overall skeletal strength and help to figure out what your risk is for fracture in the future.
All right. Is osteoporosis treatable, and if so, how?
Well, we have two classes of pharmacologic agents for it. There's the bisphosphonates, which are the most common, which come in either a pill or an IV. Those are medications that slow bone loss, and so those are the ones we use most often. But there are a couple of other anabolic agents, Tymlos and Forteo, we say for really special occasions if a person's bone density is really below what it should be for their age. And so those are the pharmacologic treatments that we use for it.
All right, and doctor, what are your recommendations for just basic health and exercise for someone who has been diagnosed with osteoporosis?
Yeah, it's a super important question, and so everyone should be doing calcium in their diet, 1,200 milligrams per calcium per day, ideally in your food versus a supplement. And so 3 or 4 servings per day of milk, cheese, ice cream, green leafy vegetables usually will give you the calcium that you need. Vitamin D is very tough living in New England because sunlight's the major source of vitamin D. And so from October to April, we're just not getting enough because even if you're outdoors all day, you're wearing a hat and a coat and the sun sets earlier. And so sometimes vitamin D supplementation is needed. 2,000 international units per day is usually a good maintenance dose. And then always weight-bearing physical activity, walking, modest weightlifting, yoga, whatever you enjoy doing as much as possible because that really helps motivate the muscles and the bones to stay as strong as possible.
So something as simple as walking qualifies. That's interesting.
Yep, absolutely. Absolutely. Get out there.
All right, get moving. Dr. Michael LeMay, thanks for joining us. We appreciate it.
Thank you.
Thank you.